Our position on vaccination has always been very clear from the beginning. Vaccination is one of the biggest pillars for us to get us through this epidemic. And so we believe in the saving of lives and livelihoods. Because if you are vaccinated, then your chances of dying are far less, they are reduced. So as much as we have all of the vaccines, all of them are great at reducing the hospitalization and deaths from COVID-19. So it's important for us to save our lives, but we also say it's good for saving livelihoods. We are all aware of the impact of COVID, the impact it has had on our economy. People have lost jobs. We've now got the highest unemployment rate in the world, and therefore if we are to be able to open our economy for the tourists to come back to our country, and in fact, tourism is one of our biggest industries, then we do need to be vaccinated. So it's not just about yourself, the vaccination is about you, it's about your family. We have people who are breadwinners who lose their lives, and I'm sure no one wants to leave their family in the lurch, but also we want that the economy must go back to normal. Our children should be able to go back to school. So the mining industry has always supported vaccination, and that's why we are doing everything. We are part of government's vaccination rollout, and we support them in that rollout so that we have as many people as possible vaccinated. The industry, in fact, employers could only start vaccinating from May of this year. We're aware health workers started in February. And unfortunately, we actually, as workplaces, were at a disadvantage. The approval of our sites took time. But from about July, mid-June to July, a number of workplace sites had been approved in the mining industry. And knowing that we had this delay, really our companies, our employees have come on board and they have been vaccinating in large numbers. We are now sitting on about today, which is the 13th of September, we're sitting at 178,000 people that are vaccinated, that is employees. And in fact, we are going on a campaign to make sure that everyone is reporting. So this is probably an underreporting of how many people have at least received one dose of the vaccine. And so we are quite happy with our progress. We have companies which have managed to vaccinate more than 80% of their employees, and a lot of others are coming through with high numbers. We have actually set some targets for ourselves so that we really make sure that by the 1st of December, most, of our employees have been vaccinated. So the progress is going very well thus far, and we just want to ensure that we reach as many people as possible, taking into account that there's always the possibility of the fourth wave. The fourth wave, last year we had our second wave, which started around December and ended in January. And so we cannot rule out that we will not have a fourth wave. And that's likely to be towards the end of November, it is said, or December, when a lot of people start moving around, because the virus thrives on the movement of people, and the spread gets easier because people are moving around. And South Africa is a nation of migrants, and there's a lot of movement around December. So we definitely want to make sure that by the time there's a lot of movement and people are going home for the Christmas break, then everyone really is fully vaccinated. Because if we do that, we can at least, be certain that there will be a reduction in the number of cases. There will be very few people who are going to die, because of the epidemic. And in fact, if most of the country does get vaccinated, we will break the back of, the COVID epidemic that we currently have. You are very right. You know, employees have families, which are their dependents. A lot of the time, they also live in a community. And so from the beginning again, our approach was that we are going to be looking to vaccinate our employees, the dependents, and the communities which are in the peri-mining areas. We do appreciate that companies have got different circumstances. Some will be able to do this to a higher degree than others, but definitely there are a lot of companies that, in fact, our first site, you know, which was in the Northwest, that company has already been vaccinating the community because it was part of the agreement with the province. And again, maybe one needs to emphasize here that a lot of the, the vaccination of communities is done in collaboration with the Department of Health. And it's been a great, collaboration that we have seen. We have mining provinces such as Limpopo, Northern Cape, Mpumalanga. They've come through, the departments of health there have actually come through to assist the companies in getting vaccinated, because there are very different, the localities where companies are very different. In some cases, it's easy to have your own facility, your vaccination facility, but in others, it makes sense to be collaborating and getting your vaccines through the Department of Health. So those provinces have really assisted some of the companies to get the employees vaccinated. But the reciprocation is that those companies and others, without that being in place, that arrangement being in place, there are companies which have put in place resources so that they also vaccinate the communities in their region. So we, even in our reporting, we actually collate information on how many employees are vaccinated and how many of the community are vaccinated. So it is a win-win situation between the companies and the communities where the companies are existing. And as I said, the collaboration with the Department of Health has made this very possible, and it is working well thus far. And I think with more employees being vaccinated, more companies are going to do more in terms of assisting in the communities, that they are situated in. COVID-19 vaccination, I think, has been a very big experiment for South Africa to see how almost like the national health insurance can work, because it's one program where both government and the private sector had to collaborate. As we know, we have got, our public health system, and the private sector served by medical aid, people who are mainly on medical aid. And those usually function quite separately. But with COVID-19, the vaccines were very new, and they were very scarce. And so the pharmaceutical companies were actually only willing to provide these to governments. And it therefore meant for everyone in the country to be vaccinated, both public sector and private sector had to work together, and it has worked very well. We have Before SA leading the business side of the private sector part, and they've done it very well. And we've got most of the workplace sites that were supposed to be in place are functional. We have the the pharmacies, private pharmacies being part of the vaccination agenda. Private hospitals, even some of the medical aid companies have got a wing that does vaccination. So it's one of the biggest collaborations that we have seen between public sector and private sector, and it has worked very well. And I think it bodes well really for the national health insurance and what is possible, because it also starts showing you where are the areas of strength in this collaboration and where are the areas which will need to be bolstered if we are to have far more, comprehensive and integrated services that are provided in the country. You know, vaccination works through numbers. There's what we call herd immunity. This is, and what that means is when you have a certain percentage of people that are vaccinated, then you manage to stop the spread of that disease. Now, that herd immunity is determined by a number of factors, and you know, some of it being how transmissible that virus is. So COVID-19 is a new virus. We know, for instance, that the Delta variant, which is the last one we have thus far, has been far more transmissible, you know, and we have found that even in populations with vaccination, you still have a level of transmission which goes on, which I think emphasizes the need for us to continue to use the non-pharmaceutical interventions of face masks. So even if you are vaccinated, we'll continue with those face masks. But definitely, the more people are vaccinated, then the less transmission you have. And again, the less transmission there is, the less variants you get. Because the other problem with COVID-19 is that there are variants that have developed. And variants develop when there is high transmission of the disease. So if we have as many people vaccinated as possible, there'll be less variants and there will be less transmission. And it means that the virus will ultimately come down. It might even come down to the level of being more like the flu, because the flu is a virus, it circulates every year, and some people who are vulnerable need to get vaccinated, but at least most people, you know, in the normal population who are very well, they don't need to get vaccinated. So I'm talking more long term, that if we do get vaccinated, then it means we can ultimately get to the, you know, the situation that I'm describing. But right now, all of us, each and every person needs to make sure that they do get vaccinated, because it will mean that we are able to, you know, continue with our lives. For instance, right now, the country is relying on the, you know, lockdowns and the restrictions to alcohol, restrictions to our movement. That's what we are relying on now, because we are not adequately vaccinated. But if we are adequately vaccinated, then we will not need restrictions. You know, people will continue with their normal lives in terms of movement, in terms of what alcohol they can use and how they use that alcohol, which we hope will be responsible, you know, utilization of alcohol. So there is a lot that we can gain from each person making sure they are vaccinated, because it will mean that there are far less people who die from the COVID-19, and we will also go back to normal and our economy will function. And again, I need to emphasize the issue of the economy, that South Africa does need to go back to being a country that is functioning optimally as an economy, because we do need the jobs that we have lost, and we do need to create new jobs. And we can only do that if we are actually vaccinated. You are very right, you know, in what you say, that part of the anxiety about this pandemic is the first time since 1918 that we have a pandemic of such a scale. And of course, in 1918, there were no vaccines, but now we do have them. And there is, understandably, there is hesitancy, because it's never happened that everyone is required to vaccinate. Most times, you know, the only mandatory vaccine that was there was the yellow fever vaccine, which is for people traveling to certain countries where there is yellow fever, and then you are required to have that vaccine. So this is all very new, and therefore it's understandable that people would be concerned. And again, the vaccines were developed, very quickly, and people now are worried about, isn't this, like microwaving? It's not real cooking of these vaccines, and therefore they are not quite safe. But I can assure people that part of why, the vaccines were quick to be developed is because um, we have new technologies that have come in, and scientists now can, produce these vaccines in a very short space of time. And again, the safety is always paramount. It's the first thing that is tested. All of these vaccines go through phase 1, phase 2, and phase 3 trials. The first phases are more about safety. So if the safety is not guaranteed, then you stop the trial. But once the safety has been guaranteed, you go on to the phase 3 trials, which are now on, a large scale and large number of people. And so we should not worry about safety. It is true that, as with everything, even medications that we take, they have side effects. So some of the vaccines do have side effects, but even the side effects have been monitored. We've got 5 billion people now that have been vaccinated across the world. And so there's a lot of evidence on what are the side effects and the risk of those side effects. And it is clear that the risks of the side effects are far less than the risks of the disease. So for instance, we have got myocarditis, which is an inflammation of the heart, which occurs with the Pfizer vaccine. We have got clotting diseases, which happen with the J&J vaccine. But when we look at the numbers, you'll find that maybe it's one person or two people in a million that get these side effects. Whereas for this same epidemic with COVID, if you get COVID, your chances of getting myocarditis or your chances of getting clotting are far higher than, the risks that are from the vaccine. So yes, there are some of these, and we try to, of these sort of the side effects, but we try to make people aware the risk and the benefit, that the benefit of the vaccine is more than the risk that you run of getting any of the side effects. And that is part of the education that is provided to the employees and to communities. And in fact, the education is one of the most critical, aspects of a successful vaccination campaign. And so we found that companies that had invested in education before the vaccine even became available, they had very high uptake because their employees were already knowledgeable about what are the risks and, what's the benefit, the balance between the risks and the benefit, and they could then take the decision that actually it's far better for us to get vaccinated. And so far in the mining industry, out of all of the 178,000 vaccinations that have been done, we are not aware of anyone who has died because of the vaccine. We are aware of two people that maybe by the time they got the vaccine, they already had caught COVID, because you remember that when the vaccination started, it was around the time of the third wave. So a lot of people that were getting vaccinated were catching COVID at the same time. And some of them did die from the COVID, but not from the vaccine. So definitely in our industry, we have no one who has died because of COVID, of the vaccine. And even in South Africa, we have not had much of people who died specifically from the vaccine. Um, Before I get to our position, let me say that the topic of mandatory vaccination is a global topic right now. And we find that it becomes a louder conversation the more people are vaccinated. So at the moment, for instance, South Africa, I think, is sitting on less than 30% of people being vaccinated. Uh, But again, there is a Department of Labor directive on an employer going through the processes of a risk assessment and declaring which occupations should have mandatory vaccination. This currently doesn't apply in the mining industry. We are starting off on a basis of we are doing very well with informed, education of our employees and voluntary vaccination. So at the moment, we don't have any policy which is talking to the mandatory vaccination of employees. But as I said, it's something that, is a topic globally. And in South Africa, it will start, the volume of that conversation, I think, will increase the more people we have, the more people have access to vaccines and people get vaccinated. Because remember, it's in the last month or 6 weeks that we've now had a good supply of vaccines, and that vaccination has been open for anyone who is above 18. So it's still early days, in terms of mandating. But as I said, it's a conversation, that is a global conversation. But in mining, currently we are encouraged by the voluntary, vaccination that is going on in the industry.